Dr. Goldin, thank you so much for joining us today.
Thank you.
If you could start, just tell us a little bit about yourself and what you do.
Yeah, so my name's Jon Goldin. I'm a child and adolescent psychiatrist. I worked in the NHS for about 30 years in the field of child psychiatry, but in the last couple of years I've been full-time in the private sector. I ran an inpatient unit at Great Ormond Street Hospital for 21 years, which I really enjoyed. We had a great team. We had some very interesting patients, lovely children and families to work with. But it felt like it was time for a new chapter, and now I'm, as I say, full-time in the private sector.
So I think to start off with, we're seeing a lot at the moment about teaching styles and schools and the impact that that can have on children's mental health. From your perspective, with boundaries that teachers have and that schools have, when is that helpful and when can that be harmful?
Well, boundaries is a really big issue for schools, for parents, for families, for teenagers. I often say about boundaries for teenagers that they should be a bit like tyres, like rubber tyres, so you can kick against them, you can push against them. They're there, they're kind of solid, but they give as well. You know, they're not kind of like a pane of glass that you kick against and it just smashes, and they're not kind of like elastic that it just stretches ad infinitum without really being a boundary. So one of my supervisors at the Tavistock many years ago gave me that analogy, Robin Anderson, and I thought it was a really good analogy. So I think boundaries are really important for young people's mental health and development, and it's how you learn how to function in society, how you learn how to treat other people, how you learn kind of right from wrong, these kind of things. So, you know, one needs to learn boundaries. I actually saw a family recently where the parents were kind of beaten down by their child who was very troubled, unfortunately, and they were just like, we're giving up on boundaries, you know, it just doesn't work, it causes an escalation in problems. And I sort of supported them to, excuse me, not take that route, as it were. I mean, I could understand why they felt that way, because they were exhausted and they felt that nothing was working. But I think a child without any boundaries is going to have a lot of difficulties for sure. And the same in school. I mean, I'm sure we'll talk more about schools. And head teachers have different views about what is and isn't appropriate in schools. You know, some schools, for example, want to ban smartphones completely. Others say, well, you know, they can have them at breaks in a secondary school. I think most primary schools would not have smartphones for sure, and which is appropriate. Uniform is another thing, so we could talk about school uniform if you want, but these are kind of boundaries that people have to grapple with and decide on. I think for parents it's really important that they discuss boundaries, because what quite often happens is a young person tries to split their parents or split the adults that might be responsible for looking after them, and they'll say, well, dad said I could do that, and mum's trying to hold a boundary, or vice versa. And so I think it's really important that the responsible adults talk to each other about the boundaries and try and agree as far as possible on a sort of common line, as it were.
And in your experience working with parents and families and children who are struggling behaviourally or with their mental health, what are the most common boundaries that you see missing?
Well, okay. I mean, social media is the obvious one to sort of draw attention to, first of all. And I think, you know, a lot of parents are struggling with that. I'm a parent, I've struggled with it. My daughters are now adults. That doesn't mean there's not still issues with boundaries sometimes. When I and when many other parents were children or teenagers, we didn't have social media in the same kind of way that we do now. And I think sometimes parents can feel that their teenager just understands more about it. If they try and put restrictions on the phone, for example, that the child will just be able to get around it. So some parents are really struggling to feel that they have any empowerment over applying boundaries around social media. So that's partly a generational thing, and I would like to encourage parents and teachers and responsible adults that boundaries still are relevant and still apply. And actually children are often grateful when those responsible for them support them with boundaries. I think a lot of children, I've been talking to teenagers over the last year or two, more and more some of them are saying they really realise that social media can be challenging for their mental health, and they actually want someone to support them to like put the phone in the kitchen to charge overnight, for example, so it's not pinging at 2 a.m. and then you're tempted to have a look at the message, and the message might be, you know, an example of cyberbullying or a nasty message or someone saying you look really stupid in that photo or whatever. It's not what you want to read at 2 a.m. And then you can't get back to sleep and you're lying awake worrying, and of course that has a knock-on effect on your mental health. So children and teenagers are often actually grateful for boundaries. They might not say that. They won't say thanks for giving me a boundary, but they often recognise that the person looking after them is trying to support them, and they kind of appreciate it.
And for a parent who's watching this and is perhaps starting to implement new boundaries, I think one of the fears that perhaps they have is, will it work? And, you know, the initial response from the child, but also how long until it works? What would your answer be to that question? How long does it take for boundaries to start to have an impact on someone's behaviour in a positive way?
I mean, that's a good question, because what we do sometimes see clinically is parents try and apply boundaries in a way that they haven't done before, and things escalate, and the child really kicks against them, and then the child thinks the parent might think this is too much. We should have just been more easygoing like we were before this clinician told me that, you know, more boundaries are helpful. So it can take time. You know, it's a bit, I often use the analogy of like turning around an oil tanker for some clinical work with teenagers. You know, parents need to be realistic that change does take time for children as well. I think one of the nice things about working in the field of child and adolescent mental health is that one has development on one side, and nothing tends to really be stuck. I mean, I know things can feel stuck, but things are rarely very stuck, actually stuck. And so when you make changes, things can improve, things can turn around, but I think one needs to know that it can take some time as well.
And in your experience, obviously you've worked, you know, for over 20 years with young people and families, and perhaps with children who are slightly more behaviourally challenged or struggling with their mental health. And I'm assuming there's quite a few times where you've had to support parents with putting boundaries in. What has been the most significant case where boundaries and applying boundaries has really changed someone's life and their experience in terms of the young person?
Well, I mean, the kind of issues with boundaries that we might see, I mean, you know, I have seen young people who, for example, are still sleeping in their parents' bed, you know, well into their teens and things. And that has become a kind of norm in that particular family for various reasons. Like the child might be very anxious, they might feel that it's necessary to do that to reassure their child. But, you know, I can think of a few examples, particularly when I was working on an inpatient unit, where children did seem very stuck, you know, developmentally, and really struggling to make progress emotionally. And when one talked to parents about how this wasn't helpful, what they were doing with good intentions to try and support the young person, again, the young person might have felt actually relieved that there was a boundary about that. You know, it's not appropriate for you to still be coming into our bed when you're 14, 15, whatever it is. And so that I can think of a few examples where that kind of discussion has taken place, and that's made a really big difference, because it kind of allowed the young person to separate in a way that most young people would have separated earlier in their life in that kind of way, no longer sleeping in their parents' bed. So it allows them to separate, it allows them to individuate, it allows them to become more independent. And that's an example of a boundary that, you know, discussing it, you know, collaborating with parents, thinking about how one could change things makes a big difference. Those are quite dramatic examples, and as I say, I worked in an inpatient unit, we saw some of the most unwell children. The situations were more extreme. But more everyday boundaries, I mean, I see it every day, that, you know, talking to a parent and getting an agreement with a family, why don't you all put the phone in the kitchen by 10:30 and charge it? You know, we as adults need to set good examples as well. I know I do. Sometimes when I'm with, you know, I might be with my family, I might be looking at my phone in a restaurant sometimes. Not the best idea, really, you know. Better just put it aside when you've got family time, just, you know, make eye contact, talk to people, don't get distracted. And so we're modelling things for our children, for young people. So if parents can model putting the phone in the kitchen overnight, for example, to charge, and that's something we all do as a family, I think the child will be quite relieved, and that will be a relatively simple intervention, sometimes not simple to implement, I realise, but more simple if the parent is modelling it. And sometimes I suggest that to families, and the child looks at their parents saying, there's no way you're going to do that. And then one has to work with the parent a bit as well, you know, so that they can all do that.
So are there some examples of what sort of boundaries parents should be setting with their children?
Okay, so we've talked about social media. I mean, I think sleep is a really important thing for mental health. So there's boundaries around bedtime, which obviously changes, you know, from when you're 2, 3 to when you're 16 or 17. That's appropriate. But I think, saying that it's actually bedtime and, when you're 16 or 17, obviously it's much less likely that the parents are going to be having those kind of conversations in the way they would when a child is younger. But one can still encourage hopefully the young person starts to internalise boundaries as well, and knows that if they're up till 2 in the morning watching videos on their phone or something, they're not going to feel great the next day. They're not going to do too well at school or whatever they're doing the next day. So young people kind of internalise boundaries as well, hopefully. Those are the kind of things that people talk about: bedtime, phones, behaviour, obviously at school is another one. So sadly, some young people get excluded repeatedly or suspended. I mean, I often say that children who are behaving badly or behaving in a difficult way or having difficult feelings and difficult experiences that they're struggling with. So, sometimes I would worry more about a child who was completely withdrawn and mute than a child that was kind of acting out and aggressive and swearing and things like that. Because at least there's a kind of liveliness to them and they're kind of expressing how they feel in a way, and then hopefully a compassionate, caring, firm, supportive adult can help them with boundaries and say, it's not okay to swear. It's not okay to hit another young person, whatever. You wouldn't like to be hit. You wouldn't like if I told you to F off or whatever. And try and, open up those kind of conversations. And, that can make a big difference.
And when you mention a firm parent, because I think for parents, again, navigating this line between what is firm enough and when's too much, what do you see in terms of, and what's some examples of a parent perhaps being too firm and there being a negative impact on the young person's mental health as a result of that?
Yeah. Well, I saw a family recently where, the culture growing up was that the child got hit when they transgressed in some way. And now the child is, about 17 years old, quite big, and they're hitting their parents. And it's a really tricky situation. And I've talked to this young person and they're saying, well, yeah, I got hit as I was growing up. My dad deserves it or whatever. So that's an example of so-called, I say firm, it's, everyone has to find the right boundaries for them, for their parenting style, for their family. It's not like there's one way of doing it that's right and one way that's wrong. And, I as a parent have shouted at my children when I wish I hadn't, and all parents do that kind of thing. So we need to be a bit kind to ourselves as parents as well. It's not about, getting it right all the time. We're all perfectly imperfect and we make mistakes on a regular basis. I think if you make mistakes as a parent and the child sees that you kind of acknowledge it, or that you're learning from it, or that you're able to say sorry, or that maybe I didn't get that right, let's try and get it a bit more right next time together. That's great parenting, I think. And it's not about being perfect.
I think that's a really important message for parents to hear as well, because there's so much anxiety, I think, that comes, especially at Lions Campus. I think when we're speaking with families, there is a lot of fear and shame sometimes, or guilt around how parents, feel about how they've been managing their children or their relationship with them.
It's hard to access help sometimes, kind of emotionally, apart from the practical issues of navigating CAMS and so on. It's hard to say, actually, I'm really struggling and I need some help. And people need a lot of courage to do that sometimes. And, hats off to parents that do come to places like Lions Campus and say, I need support with my child, or an inpatient unit at Great Ormond Street, like the one I used to run. And it's credit to them that they're willing to ask for and receive help.
And what do you think the impact is when a parent is struggling and they don't seek help? How can that manifest with the child and in the family, and ultimately, I suppose, for the parent's life as well?
Well, sadly, there's a good chance that things will just get worse or not improve in the way that they could do otherwise. So as I say, it involves some courage to seek help. When I see a young person, one of the first things I want to try and work with them on is the idea that help is available, and that maybe I can be helpful, or my team or people I'm working with can be helpful to them. Because I think a lot of young people who are really struggling come and see a professional, older person like me or whatever, and say, what have you got to offer me? What do you know about being a teenager? Even younger people like yourself, they might say that too as well. I think one wants to really listen to them. One wants to convey that you have some understanding of what they're talking about, what they're going through, and that you've got some experience in working with these kind of difficulties, and that hopefully you can help, but that you're going to be working together. You know, not that you're just going to tell them what to do and they're going to go off, but that you're going to be doing a lot of listening and hearing what the difficulties are.
I think that's interesting because at Lions Campus, I think what we see a lot is children and young adults and adolescents who perhaps have been through, you know, multiple different sort of schools, for example, or they might have been excluded from school or expelled, and you know, I think they've lost trust in adults. I think you know it's really difficult for them. And I think it was just interesting what you were saying about the boundaries with schools as well. And I'm interested to know, for children who are, you know, showing signs of behavioural struggles, how can schools navigate that? And what do you see that they might be doing wrong?
Well, I wouldn't want to lecture teachers because I think they've got a tough job, and I think most of them do an amazing job actually, and I think it's, you know, not an easy job. I think leadership in schools is really important. So schools that I've gone into that are functioning really well have often very good head teachers who really think about the whole child. They're not just thinking about whether their tie's straight or whatever. They're thinking about the young person's feelings, their mental health, their physical health, relationships. You know, as we both know, relationships between teenagers can be fraught with challenges sometimes. And one tries to sort of promote a kind of or sort of sense of well-being in school, as it were, or, you know, a holistic approach, which is not just about exams. You know, some schools you do get the feeling they just care about exams and nothing else, which is a real shame. And I think the young people struggle. And I think it's actually a problem in the UK, the national policy of sort of doing SATs for young people at the age of 7, you know, pushing them to do exams when they're really at an age where they should be more playing and exploring and enjoying themselves. So, you know, if you're going to get me started on education, there's a lot I could say about that.
So you've been working in adolescent and child mental health for over 20 years. What's the main difference you're seeing in adolescent mental health now compared to 20 years ago when you first started?
I think in many ways life has become more complicated, particularly for teenagers, you know, now compared with 20 years ago. I mean, I think the first smartphone came in 2007, something like that. So that's less than 20 years ago, just about. But, you know, life has changed so much since then, hasn't it? You know, before that, you didn't have all this information in the palm of your hand, but you also didn't have social media, you didn't have access to pornography. We haven't talked about that, but that's really worrying that, you know, the average age of young people accessing pornography, I think boys is about 8 or something, which is really worrying. You know, seeing things that are just not age appropriate. The whole social media thing that we've discussed and that I know you're very familiar with, you know, it's a kind of experiment with our young people's mental health, because it's the first time that we've got this model globally where a young person puts something out there and anyone can comment on it. And of course they want people to comment positively and say you look nice and well done and all that, and some of their friends might do that, but there's a lot of cruel people out there, or people that are, you know, just wanting to troll people on social media. It doesn't always bring out the best in people. Teenagers can be competitive or jealous, as can anyone, you know, and that can come out. And you can also see other young people having a great time, so-called, on social media, and you don't match up in your mind. So that all that is new. 20 years ago, that wasn't happening. So I think that's one of the big changes, really. I think it's increasing anxiety and depression amongst young people. I think that's one of the factors that's contributing to it. I don't want to pretend that everything was sort of easy and hunky-dory 20 years ago, because there's always been challenges for teenagers and young people growing up. But I do think that is one obvious change that's had a big impact.
And we've seen a rise in the number of a lot of mental health disorders that people are being diagnosed with and struggling with. Do you think that it's that more people are struggling with these things, or that more people are just being diagnosed now and perhaps the same number were still struggling with them 10, 20 years ago, it just wasn't diagnosed?
Yeah, I mean, that's a question that we ask a lot, and I don't think we have completely conclusive answers to that, but I think there's a general understanding that it's a combination of those factors. So I think there are more pressures, as I was saying, on young people today compared with 20 years ago. There's greater sort of disparity between rich and poor. There's challenges in families, perhaps more than there used to be 20 years ago. There's anxiety about the future for young people economically and socially. So there's more pressures on them, and I think that those things, and social media obviously we've talked about, and I think those things contribute to the rise in anxiety and depression amongst young people. So I do think there's a tangible increase, but I also think on the other side of the coin we're more open to talking about it, which is a positive thing. There's less stigma. Young people are more open to saying they're feeling anxious or sad or wanting some help. And so that could lead to an apparent increase in mental health disorders, whereas really people are talking about it more and more, open to saying that they've got difficulties that they need help with.
What's the impact of pornography use at such a young age on someone's mental health?
Well, it is a big concern that young people are accessing pornography at ages that are really not appropriate for them. I saw a statistic recently that the average age that boys are accessing hard pornography is around 8, which is really sad to hear about. What are the difficulties? Well, I mean, it shows you about sex and relationships between people in a way that is quite distorted. You're looking through a specific pornographic lens. So, you know, when one is doing sex education with young people, and I think it's quite important to be open with young people. I remember, maybe it's a bit personal to say this, but I was told about, you know, the facts of life when I was about 4, and, you know, my mum got pregnant with my sister kind of thing. And that was an appropriate time to start talking about how babies are made and about sexual relationships between men and women or between couples, parents. And but you're taught about that, and it's spoken about in a way that it's to do with love and connection, and sex is connected with that. It's not to do with, you know, people being strangled or you know, the kind of things that you see quite commonly in pornography nowadays. And I've certainly heard about many cases where, you know, boys think the right thing to do when they're making love or having sex with a girl is to sort of strangle her while they're doing it. You know, that's happening more and more, choking and other things like that, you know, that you've got to be very kind of aggressive. And, you know, that we know about the manosphere and Andrew Tate and, you know, what they're saying about relations between men and women and how men should be dominant and men should be, you know, treat the woman like they're sort of superior to them or whatever. And these are all real distortions that young people are learning about relationships between couples. So I think it's very sad, and I'm actually pleased about the new age verification, because I was seeing something just in the last couple of months that the numbers of young people accessing pornography inappropriately have really gone down since a relatively simple thing. I mean, I've been saying for years that these companies have the technology to do proper age verification, but they just haven't done that. So finally it's been kind of mandated by the government. We've got our online harms bill, and I think that's going to make a significant difference. And we've been talking a lot about boundaries today. That's boundaries at a national level and at an international level. I mean, I don't know if you know, but in Australia they're banning social media for under 16s. They're about to do that. So that will mean that young people won't be accessing pornography inappropriately in the same way that they can do without those kind of boundaries in place.
And for a parent who might be watching this and, you know, they may be concerned about their child's pornography use, what would your advice to them be?
Well, I think there need to be appropriate boundaries around the phone, and, you know, if a parent is aware that a child is doing that at an age that's not appropriate, they need to put those boundaries more solidly in place. But I also think there need to be conversations with the young person, and, you know, a parent who is able to convey to their young person that they're aware that they might see things on their phone or on the internet or at school that makes them feel uncomfortable or that they're worried about, or they don't quite know what they're witnessing, that the door is open to talk about that, either with them as a parent or encourage them maybe to talk to an older sibling or uncle or aunt or a teacher at school, whatever it is, whoever they feel comfortable with, to be able to, you know, keep the lines of communication open, because I think it's really confusing for a young person to see that. You know, they think, so this is sex, what is sex? It seems to involve violence in some way, whatever, you know, and they're very confused. So they need an adult to help them process that.
And for the parents who, because I think this is an uncomfortable conversation for parents, you know, I think a topic I think it's important to acknowledge that also it's quite uncomfortable for parents to approach that. What would your advice be to them if they're feeling anxious about approaching their child about a topic like pornography?
Yeah, I mean, there are some interesting things online about this. You know, there's YouTube videos. I know one of my colleagues actually works in this field specifically, and I know that she's done some interesting videos. Her name is Elena Martellozzo, and she's talked about how to talk to your young person about this. Yeah. And Young Minds is a really good website. They've got stuff on there, and there's a lot of online resources for parents to have a look at. But as I say, I think it's important that the lines of communication are open, that you don't as a parent necessarily have all the answers, but you're recognising and validating your child's feelings of confusion, curiosity. I don't think you want to come down on them like a ton of bricks and say you should not have done that, because children are curious. Yeah. And if it's available to them, you know, why wouldn't they have a look? But then having had a look at pornography at a young age, before they're ready to do such a thing, that's when, you know, they really need kindness, understanding, support, availability to sort of ask questions about it and make sense of it.
What's one thing you wish every parent knew about children's mental health?
You know, I think young people have lively minds, they have lively imaginations. I think sometimes people don't credit children with having as active minds as they actually have. Yeah. You know, so there's a lot going on in their heads, really. And I think I'd want, you know, parents to tune into that a bit and like talk to their young person, listen to them and see what their interests are, their worries, their preoccupations. And there might be things that are really worrying them that you wouldn't have expected would be worrying them. And if they can put that into words and talk to their parents or talk to people about them, that is a really helpful thing for a young person to experience, you know, to be listened to. So, you know, to be available, to listen to them, to support them, and to really credit them with lively, active minds and imaginations, which young people absolutely do have.
If you or anyone that you know are struggling with any of the themes that we discussed in this video, please give Lions Campus a call for a confidential conversation. You can even email me directly at sophia@lions-campus.co.uk.